So I'm very excited that we are hosting our 57th annual academic day at the Faculty of Medicine and Health Sciences of Stellenbosch University. This is a year in which we have performed very well. We have published our most publications that we've ever done in this faculty. We really try to address all the global and governmental health priorities, specifically in terms of the Millennium Development Goals. We address many of the maternal child health, tuberculosis, other infectious diseases, HIV. And then in terms of the government priorities in terms of health, Department of Health, quadruple burden of disease, TB, HIV and other infectious diseases, maternal and child health once again, trauma, violence and injuries is one of our focus areas, as well as the non-communicable diseases, cancer. So very happy and very excited about the research that are presented within these 2 days, and extremely looking forward to seeing what the next year will hold for our research within this faculty.
I'm a researcher working in University of Stellenbosch in the Department of Psychiatry. I'm going to show you today a poster of mine of an fMRI study that we've done in people with HIV. So what we've done is we've scanned a group of people who suffer from HIV and compared them to normal controls while they're receiving reward. Basically, what we do during this task is we give people money when they successfully complete the task. So the more money you get, the more excited your brain becomes, the more excited your reward system becomes. And here you can see it right here in this part of the brain is what we call the reward center. We saw it that in HIV, this reward center, that is the place where you experience novel reward, or when you anticipate something good is going to happen. And in normal people it was quite low, but in HIV it was quite high. There was quite an inappropriate response to reward. And this means that HIV is affecting the way your brain is processing the reward. And this is not such a big surprise for us, because in HIV you often have a depression, not just because of things that are happening to you, but also because the virus is influencing your brain's normal day-to-day working. So it causes your brain to also become more tired and that you are more emotionally drained. Because your brain has these inappropriate responses because the virus is influencing its neurochemistry. And so we hope to address this with antiretroviral therapy and also catching it when it starts.
Our area of research is tobacco smoking and its effect on fertility, and focusing specifically on the role of cotinine, which is a breakdown product of nicotine. 75% of nicotine is actually converted into cotinine. So what we've done is focus our research on that, and what we have found is that it actually affects motility, where the cells that are progressing towards the ovum are slowed down by cotinine, and also the viability, so whether a cell is alive or dead, will be affected by high concentrations of cotinine, where cells will actually die after prolonged exposure to the substance.